Hello everyone, our today's topic is Episcleritis and Scleritis in brief. Okay, so let's get in. First, scleritis. It is a benign inflammation of episclera, the thin vascular connective tissue between the conjunctiva and sclera. Okay, it is a benign inflammation of episclera, and if you don't know about episclera, it is a thin vascular connective tissue between the conjunctiva and sclera. Okay, etiology means cause, usually idiopathic, we don't know how it is caused. Okay, and autoimmune disease like rheumatoid arthritis and infection is rare. Then next is clinical feature. In clinical feature, it is a sudden onset redness of eye, then mild discomfort and irritation, tearing, and then significant pain. No significant pain. There is no significant pain, but a lot of tearing and discomfort, irritation, and vision will remain normal. It will not affect the vision. Okay. Then the sign will be sectorial diffuse of brightness congestion, bright red congestion, like there is appearance of in some sector there is a red congestion. Okay, and mild tenderness. No sclera is not involved because the episclera is inflamed. Management and artificial tear for lubricant, cold compression, topical NSAID, non-steroidal anti-inflammatory drug, and treatment of underlying systemic disease. Also, if present, we have to treat it. Then next is scleritis. If we talk about scleritis, it is a severe inflammatory disease. Uh, it is a severe inflammatory disease involves in the sclera, often associated with systemic autoimmune disorder. It is often associated with systemic autoimmune disorder. So it is a severe inflammatory disease. As we know about scleritis, it is not severe. It is just an inflammation, benign inflammation of episclera. But it is a severe. But scleritis is a severe inflammatory disease. Okay, which involve the sclera. But episclera does not involve the sclera. Okay. Then etiology means cause. The cause is rheumatoid arthritis, systemic lupus erythematosus, granulomatosis with polyangiitis. These all are the disease of systemic. These are the systemic disease. Okay, infection here is also it is rare. Then next is type. There is two type of scleritis. First anterior scleritis and then posterior scleritis. Of course, anterior scleritis at the front part and posterior is like not back part but it is after anterior part. Okay. Then clinical features is severe deep boring eye pain. Here is eye pain. But in episcleritis there is no significant pain. Redness of eye, both photophobia, then watering, staring, and headache, and decreased vision. But in episcleritis there is no vision decrease, but here is decreased vision and photophobia also. Then next is sign. The sign is red bluish congestion. There is only red congestion, but here is red bluish congestion in the sclera, and marked tenderness, edema, thinning in severe cases. Sclera become thin in severe cases. Also, complication is keratitis, uveitis, glaucoma, sclera thinning, permanent vision loss. Okay, these are the complication. Then next is management. Management is systemic NSAID, means we have to give the systemic non NSAID for the systemic disease, and oral corticosteroid immunosuppressive disease because it is autoimmune disorder, so we have to give the immunosuppressive drug for severe cases. And treatment of systemic disorder, as we know the cause is mainly the disease of systemic disease, so we have to control or treat the underlying systemic disorder. Okay, this is important. In exam, there is always a question like write the difference between episcleritis and scleritis. Okay, so let's learn it. Episcleritis, it is an inflammation of suprafical vascular plexus. Okay, suprafical vascular plexus because it is an inflammation of episclera. Okay, here is a suprafical deep vascular plexus. Okay, because it is inflammation of scleritis. Then there is a mild discomfort and little mild or little discomfort, but here is a severe boring discomfort because it is in deep parts. So here is a severe deep boring discomfort, okay, but here is just a mild. Then localized in a sectoral infection, there is some localized sectoral infection, but here is a deep infection and sclera thinning, chemosis or anterior chamber reaction may be seen because they are the sign. Then classification, there is neutral and simple scleritis, which we don't have to study so much deeply, so I didn't include it, but just take a knowledge about that there is a two type of episcleritis, which is nodular and simple episcleritis. Then here is anterior and posterior episcleritis, nodules. If we talk about the nodules, it is small, mobile and non-tender, but in scleritis it is large, immobile and tender. Associated systemic disease, it is uncommon but it is common, okay. The response of phenylephrine, if you give the phenylephrine, what will be the response? The blanch with 2.5 or 10%, and there is no blanch 2.5 or maybe blanch in 10%, okay, depending upon the level of inflammation. Complication none, but in scleritis there is complication like uveitis, glaucoma, choroidal 4, retinal detachment, like this type of severe. Imaging is normal scleral thinning. Then here is increase in normal increase in scleral thinning, so we have to go for B scan, okay. Treatment is artificial tear, but topical anti-inflammatory drug is given if necessary, okay. But systemic systemic treatment is corticosteroid, NSAID, immunosuppressive agent, okay. Just learn it because it is the most important question. Then next, just see about the picture. This is scleritis, okay. These are the same sorry, you can see here is not a pure reddish structure, okay, it is a bluish reddish structure, okay. And because of tearing, here is like dry eye symptoms also, okay. Then the next is, this is episcleritis, it is a severe redness, okay. Here is severe redness or redness congestion, and here is also tearing because this is also dry eye, okay. For today this much, and next topic we will study another topic. So for today, bye bye, and please like and subscribe my channel. Thank you.